On September 23rd of this year, the Biden administration released their plan to address the country's hidden but rising opioid crisis among pregnant women by distributing $1.5 billion to the states and tribes and using the federal courts and health programs like the Justice Department and VA to provide more addiction-fighting education, programs, and medicine to pregnant women. America's opioid epidemic dates back to the 19th century, where opioids were used by the Civil War Army surgeons as a cure-all to treat everything from malaria and pneumonia to injuries and wounds. But because of institutionalized racism within the healthcare medical fields and the racist medical beliefs that African Americans could not feel as much pain as white Americans, Black veterans, despite making up 10% of the U.S. Army during the Civil War, held only one known case of opioid addiction, but at the cost and suffering of thousands of preventable African American casualties because of it. Since the Civil War, though, the data has shifted, with more non-white minorities experiencing opioid addiction. In the 1980s, pharmaceutical companies started marketing opioids and intentionally omitting the significant negative addictive effects that those drugs have. And this wasn't just affecting white Americans, but marginalized communities as well, who, although lacked the same access to medical opioid prescriptions, began turning to illicit synthetic opioids that were cheaper, and many had no choice but to turn to, leading them to spiral down the same path as white Americans to addiction. And the war on drugs only further reinforced these racial disparities, not only denying minorities access to resources needed to overcome addiction, but incarcerating those that were caught with opioids or an opioid addiction. Because of it, drug offenses accounted for 2/3 of the rise of federal inmate population, and more than half of the rise in state prisoners between 1985 and 2000, with more than half of young Black men in large cities in the United States currently under the control of the criminal justice system, and middle-aged Black men more likely to have been in prison than in college or the military. And although Black Americans are no more likely than white Americans to use illicit drugs, they are 6 to 10 times more likely to be incarcerated for drug offenses. In regards to pregnant women specifically, opioid use disorders have quadrupled in recent years, and despite being the group most motivated to overcome addiction, they have been less likely to be accepted for appointments with the medication needed and more likely to die from drug overdose, other than women of the same age. And these statistics only get worse with marginalized communities. Even worse, the effects don't just affect pregnant women. OUDs are also associated with low birth weights, preterm labors, and miscarriages. Furthermore, pregnant women who reveal their disorder in order to seek treatment are also at risk to lose their children, leading to infants now being the fastest growing age group in the US foster care system, half of which is associated with substance abuse. As nice as this plan sounds, there are many problems that may arise with this policy's implementation. For one, the administration's plan is vague on funding. Without sufficient funding from Congress, this may not lead to a lasting change. And the vagueness and lack of details, incentives, and consequences for healthcare institutions may further discourage or slow down these health institutions in implementing this policy. And since the risk is shifted to the healthcare programs now in charge of giving education and access to these medications, hospitals and programs serving marginalized communities with a higher OUD prevalence or less funds to start off with will be more strained for funding and may not be ready to take all of this on. Furthermore, without comprehensive addiction care embedded within our healthcare system, stopgap efforts to take on this crisis would be very limited and have very limited impact. Despite this, though, if put in place, this policy would have an extremely beneficial impact and provide support towards those pregnant and in need of OUD care, increasing the proportion of pregnant women who receive medication as part of their court-mandated treatment plan or as a condition of probation or parole, and support marginalized communities that have higher OUD prevalence and in many of these places get jailed for months without any care. This would require some extreme political overhaul. However, I definitely believe it is a policy necessary to implement and will have an overall amazing impact. Thank you so much and see you soon.